The allied health professions are a group of 15 different professions and are the third largest clinical workforce in health and care services. You may have heard of some of these roles and some may be new to you. However, they all have one thing in common. They all play a vital part in treating, rehabilitating and improving the lives of patients. Art therapy, music therapy and drama therapy are individual professions that are forms of psychotherapy. Art therapists use art making to support people to express complex thoughts and feelings. This may be following a difficult or traumatic experience which may be hard to talk about. Art therapy can help people of all ages and at all stages of life and aims to reduce distress and improve social, emotional and mental health. Music therapy is helpful for people who have difficulty communicating verbally. For people affected by disability, illness or injury, working with music therapists can be life-changing. For example, children with autism can develop emotional, social and communication skills, or an older person frightened by the isolation and confusion brought on by dementia can, through the power of music, connect with their memories again and share these with others. Drama therapy uses role-play, voice work, movement and storytelling to help people explore and solve personal and social problems. Art, music and drama therapists can work in a wide range of settings including hospitals, schools, prisons, community services and many other places.
My name is Emma and I'm a general dietitian.
My name is Chandler and I'm also a general dietitian.
So our day-to-day role is incredibly varied, no day is the same. We're looking after a large variety of patient groups, so anything from artificial nutrition, so anybody who needs to be tube fed. We see people for wound management who need high protein diets. We can see oncology patients, we can see surgical patients that have got large wounds that need healing or preparation for or after surgery.
The best thing is the variety and meeting new people and helping them throughout different life stages and different conditions and the role that food and nutrition plays in their healing.
Our role is massive, no day's the same, no patient's the same, and it's very sort of individual, and looking at that individual patient definitely keeps it exciting and varied.
So my name is Teresa, I'm a diagnostic radiographer for the UHDB. My day-to-day role involves scanning a wide range of patients. We scan like outpatients, inpatients, pediatric patients. We also are involved in some screening programs, cancer pathways. We do a wide range of scans, X-ray, CT, MRI, ultrasound. The best thing about my job is definitely dealing with the patients on the daily basis. So we scan 90% of the patients that come through the hospital. So it's a great experience to be able to be part of this multidisciplinary team. This is an amazing profession. You've got so many paths, so many modalities to choose from, and you involve with all the different departments in the hospital as well. Yeah, please come and visit us and find out more about diagnostic radiographer.
Hello, my name's Karen. I'm an occupational therapist and I work within mental health. We work with people of all ages. We work towards people's personalised goals and we use meaningful activities to promote people's independence. We support people to manage the impact of their illness. This could be their anxiety, a physical impairment or a learning disability. Occupational therapists have skills which are transferable to different work areas. These might be schools, hospitals, mental health services, older adults and also working with young people.
An ODP is an operating department practitioner. They work within all different specialities throughout theatres. They can work in all different areas such as anaesthetics, scrub and recovery. We are the patient's advocate throughout the whole of the perioperative journey and we can work alongside different other professions such as anaesthetists, surgeons, nursing staff and healthcare support workers. Our aim at the end of the day is to make sure that the patient is safe and has excellent patient care delivered to them at the end of their surgical journey. The main reason I was attracted to this profession was because I wanted to make a difference to the patients that were experiencing very difficult time coming through the theatre journey. It is a very diverse role. You will learn lots of skills along the way, and you have to be dedicated and you have to be interested in the care of the patient.
Hi, my name is Michelle and my role at UHDB is Deputy Head Orthoptist. My role as an orthoptist involves the management of your binocular vision and how your eyes work together as a pair. So basically we see everything from children with squints and lazy eye, right through to adults with complex eye movement disorders associated with head injury, stroke and lots of neurological conditions. So it's quite a widespread variety of patients that we see. The best thing about my job as an orthoptist is knowing that we can make a difference, that we're working with the children and the adults and we're making them feel more comfortable. We're treating vision problems in children that will make a difference throughout their life, and we're helping these adults with eye movement problems and double vision and hopefully making them more comfortable while they're recovering from whatever condition they've got.
Orthotists correct problems or deformities in muscles, nerves and bones with a range of aids or orthoses, such as splints, braces and special footwear. These orthoses help people who have problems with walking or other types of movement, and can also help to reduce falls, reduce pain and to prevent or treat ulcers. Orthotists treat patients with a wide range of conditions including diabetes, arthritis, cerebral palsy, stroke, musculoskeletal injuries, sports injuries and trauma.
My name is Jeremy. I am a senior osteopath here at Burton Hospital. So what do I do on a day-to-day basis as a job? So a patient will usually come in, we will assess them, we'll take a long detailed case history. Most of the job is in the case history. We want to find out what's going on, why it's going on, and then the big question is what we're going to do to help them. From that point, we'll go through our examinations, whether it's orthopedic, neurological examinations, passive range of movements, our own examinations as well. From that, come up with a diagnosis, and then the big question, the plan of action. We will then implement that. It can be through manual therapy, it can be through acupuncture, it can also be through lots of physical rehab based on their goals and based on what they want to achieve. And it'll be patients from all walks of life, all different backgrounds. It could be from ankle issues, from shoulder issues, to back issues, to knee issues, whatever it may be. It could be young, old, professional athletes, or everyone in between.
Paramedics use advanced decision-making skills to assess and manage wide-ranging and unpredictable situations safely and effectively. This commonly includes treating urgent or minor illnesses and providing an emergency response to medical and traumatic events. Paramedics often care for people in their own homes to help reduce avoidable hospital admissions. As well as on ambulances, paramedics can work in GP practices, hospital emergency departments or police custody suites.
Hi, my name's Lewis and I'm a physiotherapist. We work with people of all ages affected by injury, illness and disability, usually through movement and exercise, manual therapy, advice and education. So you'll find physios in many clinical areas, including hospitals, communities and outpatients. And we work with people with a wide range of conditions, and they can range from musculoskeletal, respiratory, orthopedic, or even neurological conditions. The aim is to facilitate that independence, encourage reablement back into the community, and achieve any goals that's personal to them. What do I love about my job? Well, it's so good to be part of someone's journey through recovery towards independence. One example that really stands out to me was working with a young woman to be able to actually stand up on a wedding day and to see the difference that it actually made for her.
My name's Demi and I'm a podiatrist. So podiatry specialises in treatments and medical problems affecting the lower limbs, so anywhere from the knee down as a general rule. We deal with anything from diabetes, routine care, we also do MSK and biomechanics, so that's how you walk, things that are painful. And we don't just deal with the elderly generation, we also deal with young people, athletes, and we also go into hospital and ward rounds, which is quite fun, I enjoy that. And you can also go into forensic podiatry within the police force if you want to. The broad range of stuff that we do keeps you interested every single day. I can say I haven't been bored since doing this job. I work within the hospital setting, but I also work within community. So we do routine care, home visits, and we also do nail surgery, which is really, really fun. But the best part of my job is the team and working within the hospital. It's the bit I love the most.
My name's Gordon and I'm a prosthetist. Day to day, I work in a clinic with people who have suffered the loss of a limb. We work with them to find out what they want to do and then to design the artificial limb so that it fulfills their needs. It's a very good job, it's very rewarding, so I would obviously advise people to go for it. In terms of practical stuff, it is better if you can work with your hands because it's a very hands-on job. There's a lot of engineering as well that goes with it, so if you enjoy engineering and you like working with your hands and you want to work with people, I would heartily recommend it.
My name is Muna and I'm a therapeutic radiographer. My day-to-day role as a therapeutic radiographer is treating cancer patients with radiotherapy. This is the use of high-energy X-rays to kill cancer cells. The best part of my role is the patient care, being able to be there for patients at a vulnerable time in their life. If you are somebody who is interested in patient care along with the science and technical side, this career is a blend of both. My advice for anyone looking into this profession would be to come and attend one of our work experiences. We are a friendly team and would love to show you what we do.
Hi, I'm Tim. I'm a speech and language therapist. I work here in the hospital with people with neurological difficulties, rehabilitating from head injuries, strokes, and various other progressive neurological difficulties. What does a speech and language therapist do? Well, we work with all ages of people, right from infants to the very, very elderly. We work with people who are learning to swallow for the first time, or people that can't swallow at all and have lost that ability, and we help them to rehabilitate it. We work with all kinds of communication impairments as well. So people who are learning to communicate for the first time, maybe people that are struggling with their voice as a professional voice user at work, and people that have lost the ability to communicate well, maybe following a stroke or a head injury or some other kind of progressive neurological condition.
What I love about occupational therapy is the challenges and rewards, getting to know people and working towards their goals and supporting people to rebuild their lives.
Helping people to communicate and express what's in their mind and what's on their heart in the moment that they want to is really important. So if you like helping people to connect with other people, speech and language therapy is a really great thing.
The best thing about my role is working with the people, getting them to do what they need to do and seeing them improve. When we see people initially, some of them can't walk, but then to see them stand up and be able to walk and to go on and to do what they want to do with their life.
Sometimes it is difficult to help others, and sometimes you really make a big difference. And for those ones that you do, it makes everything worthwhile.
To become an allied health professional, you will need to study a degree in your chosen profession, with the exception of art, music and drama therapy, which require a master's level degree. AHP degree courses are typically 3 years in length and can be studied at a range of universities across the UK. On completion of a degree, you'll be able to register with the Health and Care Professions Council and practice as a registered clinician. Many allied health professions also employ support workers in their teams. AHP support workers do not require a degree level qualification and work under the direction and supervision of the registered AHP to deliver a wide range of treatments and interventions to patients and service users. In some professions, there are opportunities for AHP support workers to complete their professional training via a Level 6 degree apprenticeship. It is recommended that anyone who is thinking of working in healthcare should complete a short period of work experience before applying to university. This will provide you with the reassurance that you have made the right career choice and also support you with your university or job applications. Visit one of our local trusts' websites to find out more. If you're interested in any of the professions you've heard about today, you can visit these websites to find out more. We hope you have been inspired to explore some of the varied and exciting roles within the allied health professions.